When you hear a doctor say elbow arthritis, it sounds like a single, straightforward diagnosis. But that term is actually a catch-all. It masks two entirely different diseases that operate in two very different environments. The danger here is treating all elbow pain exactly the same. If you assume there is one standard surgical pack for elbow arthritis, you risk choosing an intervention that permanently limits what you can physically do with your arm. Before you even think about surgery, you have to answer a critical question. Is your joint damage a localized mechanical problem, or is it a systemic disease? Misidentifying the root cause and rushing into the wrong surgical repair will permanently destroy the specific physical capabilities you might be trying to save. This diagram breaks down the two paths. On one side, we have the mechanical track, which is primarily osteoarthritis. This is a localized wear and tear condition. It usually develops after years of repetitive stress, like heavy lifting or manual labor, or from an isolated past trauma, like a fracture or a dislocation that altered how the elbow joint moves. On the side is the systemic track, most commonly rheumatoid arthritis. This is a widespread inflammatory condition. Here, your immune system mistakenly attacks the synovium, the tissue lining your joints. It actively destroys its own tissues, and it happens regardless of how much physical activity you do. Because it's systemic, rheumatoid arthritis usually attacks both elbows at the same time, often along with your wrists and hands. Osteoarthritis, by contrast, usually isolates the specific joint taking the most punishment, which is almost always your dominant arm. Knowing which track you are on dictates your entire endgame. You are either fighting a mechanical battle to preserve your arm's capacity for heavy loads, or you are fighting an autoimmune battle to stop total joint destruction. This matrix tracks both paths. Starting with the mechanical origin, protective cartilage wears away completely. Bones grind against each other, triggering osteophytes, or bone spurs. These spurs create a hard mechanical block. You preserve mid-range movement, but physically lose the ability to fully bend. In the early stages, conservative treatments like anti-inflammatory medications, bracing, and cortisone injections are used to manage pain, but they do nothing to stop the physical grinding inside the joint. When pain becomes constant, the primary early-stage surgery is arthroscopic debridement. The trade-off is clear. The surgeon clears out loose bone fragments and shaves down spurs, restoring motion. However, they cannot replace missing cartilage. You are left with a rough joint surface, meaning discomfort remains. For severe end-stage mechanical destruction, where the joint is completely ruined, one option is an elbow fusion. The trade-off for a fusion is severe. The humerus and ulna bones are permanently locked together. You will experience a 100% loss of your elbow's ability to bend. But you get a significant benefit in return. You get a completely stable, pain-free arm that can still endure the extreme stress of heavy physical labor. The entire mechanical surgical path is a series of compromises. Every intervention is designed to prioritize physical strength and stability over natural, fluid joint movement. Moving to the systemic track, the origin is different. Chronic inflammation swells the joint lining, gradually eating away at bones and stabilizing ligaments. Instead of a bone spur block, the elbow suffers diffuse pain and severe instability. The joint becomes loose and gives way. Systemic drugs like disease-modifying anti-rheumatic medications are the first line of defense. But when persistent local inflammation doesn't respond to medication, surgery becomes necessary. The targeted early surgery here is a synovectomy. By removing diseased tissue, the surgeon significantly reduces pain and slows joint dissection. The trade-off is, this isn't a permanent cure. You still require ongoing systemic medication to prevent inflammatory tissue from growing back. Unlike the structural repairs of osteoarthritis, early treatments for rheumatoid arthritis are a race against autoimmune destruction. You have to prioritize disease management over mechanical load capacity. When the joint is completely destroyed, regardless of which track you started on, the ultimate end-stage intervention is a total elbow arthroplasty, a full joint replacement. The massive benefit of a replacement is that it provides near-perfect elimination of arthritic pain. It completely restores normal, low-impact daily functions, allowing you to feed yourself, dress yourself, and reach overhead with agony. But look at this scale carefully. The critical reality of an elbow implant is a strict lifetime lifting restriction. You can never lift more than 10 pounds again. Ignoring this causes catastrophic loosening. Mechanical stress will literally tear the metal implant from the host bone. Unlike a modern hip or knee replacement, an elbow replacement is not a reset to your original capacity. It is a permanent trade. You give up all your physical strength in exchange for a pain-free life. This chart shows how to map your decision. Joint preservation maintains your physical ceiling, but leaves you with some residual pain. A replacement cures the pain, but permanently caps your physical ceiling. If you are a young, active patient or a manual laborer, you represent the mechanical profile. For this profile, you need to exhaust all joint-preserving options, like arthroscopic debridement. You must avoid a total replacement at all costs until you are fully ready to permanently retire from heavy lifting. If you suffer from rheumatoid arthritis, you represent the systemic profile. Because systemic inflammation naturally lowers your physical demand ceiling over time, your lifestyle aligns perfectly with the physical limitations of an elbow implant. For you, accepting a 5 to 10 pound lifting limit is a highly favorable exchange for regaining a stable arm and eliminating the chronic pain. Successful elbow arthritis treatment isn't about choosing the newest or most invasive surgery. It's about matching the intervention to the mechanical reality of your disease and understanding exactly which lifestyle trade-offs you refuse to accept.
If you like this video, give us a thumbs up